Welcome back. So the topic we'll be discussing today is CVS, that is nothing but the cardiovascular system. And today I'll be doing note taking in this particular manner. So this will be easier for you to see as well. So here goes the title. So I'll just change the color. So this is nothing but the title area, and this is nothing where the headings will come under. This is called as kernel's note taking, and here you'll have the main notes, and here there will be the summary to summarize the page. Okay, so now let me erase this and let's get started. So let me just erase this. Okay, so now we are starting, and I'll take the color red. Okay, so firstly, in CVS, the headings we need to know is ACE inhibitors, ARB, that is angiotensin converting enzyme inhibitors, angiotensin receptor blockers, direct renin inhibitors, and important calcium channel blockers. Okay, and also there are some important diuretics that needs to be known. Okay, so these are some important topics, and if you're wondering about the classification, it has already been given in the previous video, so you can look at it as well. Okay, so now moving ahead, we'll be looking at ACE inhibitors now. Now the topic of discussion is ACE inhibitors. So this is the topic of discussion. So looking at ACE inhibitors, it is ACE. Okay, so it is nothing but the first line of drug in case of hypertension. Okay, so it is nothing but the first line drug in case of hypertension. Now just looking at the mechanism of action of the ACE inhibitors, first thing is what happens is we need to look at what exactly happens. So the angiotensin 1 is converted to angiotensin 2, and this is in presence of ACE inhibitors. Okay, this is in presence of ACE inhibitors, and what this angiotensin 2 exactly does is that this angiotensin 2, it acts on the blood vessels. Okay, and also action on aldosterone release, and also it attacks the heart, action on the heart, and increase of the sympathetic activity. Now looking at the points under blood vessels, it results in constriction and increases the total peripheral resistance. And looking at the aldosterone release, it results in sodium and also the water retention, and this results in rise in the blood pressure. Now looking at the action on the heart, it results in cardiac hypertrophy, and also remodeling. So these are the main actions. So now as I finish the page, I'll be summarizing this. So we had just seen that we have read ACE inhibitors. Summarizing, I'll do it in black. So looking at the summary, ACE inhibitors we had read, and it is nothing but the first line drug in hypertension, and then the action is on blood vessels, and also aldosterone release, acts on the heart as well, and the sympathetic activity is increased. And if you look at, let me quickly change the color, and if you look at the blood vessels, it results in increased peripheral resistance. That is nothing but, we can also relate it to constriction. And looking at aldosterone, it results in sodium and water retention. And in the heart, it results in cardiac hypertrophy and also remodeling. And sympathetic activity is also increased. Okay. Now, as a whole, you can relate it to increase in blood pressure. So these are the main action of the angiotensin 2. So this is nothing but what is discussed is the action of angiotensin 2. But in the presence of AC inhibitors, the angiotensin 1 is unable to form angiotensin 2. Okay. So this is what we have seen totally in this page. Now, moving further, we just saw the mechanism of action. Now, quickly going through the pharmacokinetics of AC inhibitors. Now, looking at the pharmacokinetics. Okay, one second. Looking at the pharmacokinetics of AC inhibitors. So they are usually given orally. And drugs such as enalaprilat can be given IV. And it is mainly the food affects the absorption. So the absorption, if you see, it is affected. The food affects the absorption, and it is often recommended to give the drug before meal. Now, it also, if you see the blood-brain barrier, it poorly crosses. So it poorly crosses the blood-brain barrier. Now, looking at the metabolism, almost 70 to 80% of the drugs, it is nothing but it is metabolized in the liver and excreted in the urine. Now, looking at some of the adverse effects. So, in case of the adverse effects, what do we have? Adverse effects, there is cough, there is angioedema, proteinuria, teratogenic effect, as well as there is hypertension and neutropenia. There's rash, itching, loss of taste, hyperkalemia. Okay, so this is very important to know. So the mnemonic here is captopril, and these letters you can easily identify them. Now, moving ahead, we'll be looking at some uses as well. So the uses, this is the main important. So where is it used? It is used in hypertension. It is used in case of MI. It is used even in CHF, that is okay, and also diabetic nephropathy, DN, and scleroderma renal crisis. So we are done with this page and we'll quickly recap them here. So I'll use black. So we had just read what is the PK, that is pharmacokinetics. Pharmacokinetics, we have discussed that it is mainly taken orally, and it poorly crosses blood-brain barrier. Poorly cross BBB. And the excretion part, it's as usual. Now, if we look at adverse effects, we have the mnemonic captopril, which needs to be memorized. It's easy. So as suggested, it is nothing but, let me change the color. Okay. C for cough, angioedema, proteinuria, teratogenic effect, and neutropenia, rash, itching, and loss of sensation. Now quickly going to what are the uses. So looking at the uses, there is, I'll be writing the same thing because it's very important. So there's hypertension, MI, CHF, DN, and scleroderma, renal crisis. So hopefully this is clear. Now we'll be moving further. Now even the uses are over, and looking further, we'll be discussing the ARBs. That's nothing but the angiotensin receptor blockers. So we have the ARBs. We have the ARBs. That's nothing but the angiotensin receptor blockers. So it's also known as angiotensin receptor antagonist. Okay. So looking at this, the examples as mentioned earlier, first we'll just quickly look at the examples. And if you want to know the complete list of examples, you can always check it in the previous videos. That is, I have mentioned the classifications individually. So there's losartan. All the sartans basically comes here. Okay, losartan, irbesartan, just to name a few. Irbesartan, candesartan. Okay. And now moving further, looking at the uses. So firstly, we just saw a quick view of what are the examples. And now looking at the uses, it can be used in hypertension, CCF, MI, congestive cardiac failure, MI, DN, and this is similar to the ACE as well. And it also delays the renal complications in diabetes patients. So it's used in diabetic DN as well, diabetic nephropathy. And moving further, looking at the adverse effects, some of the adverse effects. So AE. So some of the adverse effects, it results in, it causes less adverse effects. So it's better tolerated compared to the ACE inhibitors. However, it can result in some minor problems such as the headache, hypertension, and weakness, rash, nausea, vomiting, and also the teratogenic effect. Okay, so these are very important to know. So next we'll be looking at the mechanism. So what happens is looking at the mechanism. So here the ARB, it inhibits the binding of angiotensin 2 to the AT1 receptor subtype and it's a similar action, that is the angiotensin 2 effects are not brought out. Now looking at this, we'll quickly summarize what we have just learned. So here, summary. Here we have seen the examples. So as mentioned about ARBs, the examples are nothing but the sartans. Moving ahead, we have also seen the uses. It's common. I'll be writing the entire list because it is important. Use. Hopefully we can recollect. It is hypertension, congestive cardiac failure, myocardial infarction, diabetic nephropathy. So these are important. Now moving ahead, we'll be looking at some of the adverse effects. And in the previous we had a mnemonic, that is captopril. Here, however, there are minor headaches, hypertension, weakness, you have rash, there's vomiting as well as teratogenic effect. Okay, headache, hypertension, and as well as rash, vomiting, teratogenic effect, nausea. And they can also lead to hyperkalemia, This is important and should be mentioned. Results in hyperkalemia as well. Okay, so I'll tell again, it's hyperkalemia. It's important. Now, looking further, we also have another small point to add is the mechanism. So, mechanism of action is nothing but the angiotensin receptor blockers. It completely inhibits the binding of angiotensin 2 to the ATR tensin receptor subtype. Okay, so the angiotensin receptor blockers, it acts on the angiotensin receptor subtype and blocks it, so it prevents its effect, and that's how it is. Now moving further, we'll be looking at a quick note on L-carnitine. It is nothing but a direct renin inhibitor. So quickly looking at it, it is L-carnitine. So what is it? It is nothing but a direct renin inhibitor. Okay, and looking at the mechanism, we'll be looking at mechanism as well. So mechanism of action, what is it? So basically there is angiotensinogen is converted to angiotensin 1, and this is in presence of renin. Okay, and this L-carnitine, it inhibits renin. L-carnitine, it basically what it does, it inhibits renin, so the conversion of angiotensinogen is not converted to angiotensin 1. So what exactly happens is the angiotensin 1 is not produced, and if you look at the use, quickly looking at use, where is it used? It is used in hypertension in combination with the diuretics and also the ACE or the AR inhibitors. Okay, ACE inhibitors or the ARBs, it can be used. And point to note is it is given orally. And adverse effects can include, looking at the adverse effects, it can include diarrhea, as well as abdominal pain, headache, as well as angioedema. Okay, so hopefully we are going good. And now we'll quickly come to the summarizing part. So I'll just change this to blue, or this blue. Now quickly looking at the summary part. So we had read about L-carnitine. So what is it? It is nothing but a DRI, that is direct renin inhibitor. So what it does is it inhibits conversion of angiotensinogen to angiotensin 1. So basically it decreases the angiotensin 1 production. And looking at the use, it is used in hypertension and can be used in combination with other drugs such as ACE, ARBs, as well as diuretics. And looking at the adverse effects, it can result in diarrhea, as well as abdominal pain, headache, as well as angioedema. Okay, now moving further, we'll be looking at some other topic, that will be the CCB, and very important, it is the calcium channel blockers. A quick note on that as well. So it is calcium channel blockers. So here, as told earlier, we have the dipins mostly. So examples we need to know. We have the dipins. So there is nifedipine, nifedipine, amlodipine, clinidipine, just to name a few. Others you can check in the classification video. And looking at some of the uses and looking at some of the side effects. So now firstly we'll see some adverse effects it can cause. So it can result in headache, flushing, ankle edema, It can also result in palpitation as well as reflex tachycardia. Now moving further, we'll be looking at some other to do and to not. So what you should not do. Okay. So we need to make sure that verapamil and diltiazem should be avoided in patients with cardiac dysfunction. Can cause cardiac depression. So this point needs to be known and should not be used in case of cardiac dysfunction. Okay. Avoid in case of cardiac dysfunction. Okay. Now another important point is the use, where it is mainly used. So it is mostly recommended in case of elderly patients. In case of elderly with angina, asthma, as well as peripheral vascular disease, and also migraine, hyperlipidemia, diabetes, as well as renal dysfunction. Okay. Now I'll be quickly summarizing what has been discussed here. So we have nothing but just highlighted few points on calcium channel blockers. So as mentioned, the main examples are dipines as well as the verapamil and diltiazem. And one point we have learned about this is that the verapamil and diltiazem can result in cardiac depression and should not be given in case of the cardiac dysfunction. And now looking at other points, looking at the adverse effects of what it can lead to. It can lead to headache and flushing, as well as the edema. Okay, that is ankle edema, can result in ankle edema, as well as reflex tachycardia. Now moving ahead, we also saw some of the use. Where is it used? Mainly in case of elderly it is recommended, and it can in case of angina, asthma, and in case of migraine, and also in case of PVD, that's peripheral vascular disease, hyperlipidemia, diabetes, as well as renal dysfunction. Now we'll be quickly giving a note on the beta-adrenergic blockers as well, because they also form an important aspect. So now we'll be looking at beta-adrenergic blockers, and this is very important. And looking at some of the beta-adrenergic blockers, there is selective and non-selective. Let's be giving two examples, and others can be seen in the video before. And we have atenolol as well as metoprolol, and here there is propranolol as well as timolol. Okay, so looking at the use, how does the mechanism action takes place, and mechanism is basically it is used in case of hypertension. So quickly giving a note on mechanism of action. So the beta blockers, it acts on the heart, and as we know, it decreases the heart rate, decreases the force of contraction, decreases the cardiac output. And as a result of these three, it results in lower BP. And next, looking at the action on the kidney, what it does is it decreases the renin release, as well as finally ultimately it causes decrease in BP. And looking at the sympathetic outflow, it also decreases the sympathetic outflow. So because of the decrease in sympathetic outflow, there's also a decrease in the blood pressure as well. So this is the major mechanism of action. And looking at the use, where is it used and where should it be used? These beta blockers, they are used in young hypertensives and with high renin levels. So people with high renin levels, it can be used. And also in associated conditions such as used in case of angina, as well as post-MI, migraine, as well as psychosomatic disorders as well. And also patients who are receiving the vasodilators in case of the reflex cardia with tachycardia. Now we have just read it, and I will be giving a quick recap of what we have just done. So now moving back, we have learnt about the beta-adrenergic blockers. So as we know have to know the main classification. It can be selective as well as non-selective. And I have given two examples for selective. You can name few like atenolol, metoprolol. And in case of non-selective, there is propranolol and timolol. And looking at the main mechanism of action, it causes decreased BP. BP is reduced, and this is by action on the heart as well as the kidney. So here what happens is the most of the thing is low. That is the heart rate, FOC, and the CO. Everything is lowered. So there is decrease in BP. As well as in kidney, there is decrease in renin. Okay, because of this, there is also really decrease in the blood pressure. And looking at the sympathetic flow also, there is decrease in the BP. That is nothing but the blood pressure. Now, looking further, the other points is to note is that moving further, some other points is it can result in, have I mentioned the adverse effects? No. So we'll be quickly noting that as well. So what can it result? It can precipitate congestive cardiac failure as well as bronchospasm. So this point needs to be known, and also can cause sexual dysfunction in males, and also can lead to nightmares as well. And in case of diabetic patients, they should be used with caution. That is, diabetic patients should be used with caution. And there can be withdrawal symptoms that can be noticed. So withdrawal symptoms can also be noticed with this. So it should be cautiously used. Now we are done with the beta-adrenergic blockers. So quickly, since the topic of beta blocker is over, so I'll be quickly giving a note on that. So what we have discussed in this page is about the adverse effects. So this adverse effects, it can result in precipitation of CCF as well as bronchospasm, and also known to cause sexual dysfunction in case of males, and also it can result in nightmares. Okay, and it should be used with caution in case of the diabetic patients. can result in withdrawal symptoms as well. Now, moving further, we can look at some vasodilators. So these can be also important. Now, quickly looking at the vasodilators. So we have a topic of vasodilators. So the important being minoxidil and diazoxide. Okay, so now we'll quickly look at the mechanism of action. So in such a case, I'll be giving an example of minoxidil. So what it does is it activates the calcium channel. So it opens the calcium channel. Calcium channel is opened, and this results in it's potassium channel. So potassium, there's efflux of potassium, and what happens is there's hyperpolarization of smooth muscles. So there is a hyperpolarization of the smooth muscles, and the hyperpolarization of the smooth muscles results in vasodilation, and it results in decreased blood pressure. So this is an important mechanism that needs to be known. And looking specifically about minoxidil, some points to note are it is a arteriolar dilator. Some important points to note are it's an arteriolar dilator, and it is effective orally as well. So you can say it is orally effective, really can be effective, and can result in reflex cardia. Some adverse effects results in reflex tachycardia, as well as it can cause sodium and water retention as well. And so because of this, it is used mostly with beta blocker and a diuretic as well. So this can be given along with beta blocker and diuretic. And the topical minoxidil is used to promote hair growth. This is topical use. So now we have learnt about some vasodilators, example being minoxidil diazoxide. To know more, you can see the previous classification. So now we'll quickly summarize what we have just learned here. So this is about looking at the summary. We looked up on the MOA, mechanism of action. So here what we get to know is there's increase in potassium efflux. Because of that, there is hyperpolarization and results in vasodilation. And because of the vasodilation, there is decreased BP as well. And looking at minoxidil in specific, we have seen that it's a arteriolar dilator. Topical use, it can be used for hair growth, and it results in reflex tachycardia. So I'll write it in red. Reflex tachycardia, as well as it results in sodium and water retention. So because of this, it is always administered with, it can be used along with beta blocker as well as the diuretic as well. Now moving further, we'll be looking on an important topic, that is highlighting on sodium nitroprusside. So moving ahead, looking at, let me change the color. This will be on sodium nitroprusside. Sodium nitroprusside is arteriolar as well as venodilator. So it is arteriolar as well as venodilator. And we'll be looking at the action and the effect of sodium nitroprusside. As we look, as a venodilator, what it causes is, as a venodilator, it results in pooling of blood in veins, So pooling in veins, and it decreases the venous return, decreases the preload, and decreases the cardiac output. So the venous return is decreased, so naturally the preload is also decreased and the cardiac output is decreased, ultimately really directs to the decreased blood pressure. Next, arteriolar dilator. It causes decrease in PVR, that is peripheral vascular resistance, as well as decreases the afterload and naturally decrease BP. Other important point to note is the sodium nitroprusside. It generates NO, that is nitric oxide, and it relaxes the vascular smooth muscles. So it relaxes vascular smooth muscles, as well as it results in the vasodilation. Okay, so this was an important point to note, and as well as it acts on the cyanide, and cyanide is converted to thiocyanate and is further excreted in the urine. So now quickly we just went through the MOA, that is the mechanism of action. Quickly summarizing what we have learned, that is, we saw that the sodium nitroprusside, it is nothing but a good AV, that is arteriolar and venodilator. So you can say it is quite balanced. Now looking at the mechanism, it releases the NO, that is nitric oxide, and this results in the vasodilation, as well as cyanide in the liver. It results in thiocyanate and is excreted in urine. This is another point. And looking at exactly the mechanism, venodilator. So here what happens is the pooling of blood takes place, pooling of blood in vein, and the venous return is reduced, and ultimately there is decrease in BP. And as a arteriolar dilator, here what happens is the PVR is decreased, and this results in decreased afterload and ultimately causes decreased BP as well. So these are the points that we discussed here. Now moving further, we have looking at a case of hypertension. Or before that, I'll quickly give a note on the nitroglycerin. Nitroglycerin, what is it? It is nothing but mostly a venodilator, and it is used in case of hypertension associated with the LVF, that is left ventricular failure, as well as the MI, that is myocardial infarction. And it acts rapidly, whereas also it develops tolerance as well. So these are some points. Now we'll be looking at hypertension and how do you treat this. In case of hypertension, what needs to be done? So this is a case of hypertension. Here, firstly, we can try non-pharmacological approach, and this includes decreasing weight, sodium restriction, alcohol restriction, exercise, mental relaxation, as well as decreasing smoking or avoids complete smoking, as well as rich potassium diet can be utilized. Now looking further at the drug treatment, there is antihypertensive drug, and these drugs can also depend on factors such as comorbidity, age, sex, cost of the drug. These are some factors that need to be known. But we'll be also looking at some other drugs that can be used. In case of hypertension, we can use the ACE, ARB, CCB, as well as thiazides, and these were already discussed earlier. And looking at the therapy, firstly it should be started with a single agent, one. So this needs to be known, and also combination therapy can be given. In case of one drug doesn't work, you can try combination. So combination can also be done, and combination of, usually you can do ACE or ARB along with thiazides, CCBs or diuretics. So this can be a possible combination that can be given. And combination of verapamil and diltiazem should be avoided with beta blocker, as mentioned earlier, because it results in the cardiac dysfunction. We have seen that earlier. Now quickly summarizing what we have done, and here I had given a note on the nitroglycerin. So looking at the summary, we have studied what is nitroglycerin. Nitroglycerin is nothing but a venodilator, right? Yes, it is a venodilator. And another point we looked at is it is used in case of hypertension associated with left ventricular failure as well as the myocardial infarction. Used in hypertension with MI or the left ventricular failure. Now looking at some of the points that we looked is in case of treatment of hypertension. This is very important. So hypertension, how do you deal with a case of hypertension? Firstly, you tell about non-pharmacological approach. So non-pharmacological approach. So what does this include? This includes decrease in weight and increase in potassium diet. Okay, as well as you can tell the person to stop smoking, and there can also be you can advise the patient on exercise as well as mental relaxation exercise as well. So these are some points which needs to be known, and we also spoke about what are the other drugs that can be classes of drugs that can be administered. So they include, as we discussed earlier, ACE, ARB, calcium channel blockers. And in case of therapy, what needs to be done is firstly we try for one class of drugs. And in case it doesn't turn out good, we can include with a combination. A combination we can include ACE or ARB along with thiazides, calcium channel blockers as well as diuretics. And another important point that I mentioned earlier, I'm repeating again, that verapamil and diltiazem should not be given with beta blockers. Should not be given along with the beta blockers. Okay. And why is it so? Because there's cardiac suppression that can be seen. So next topic, what we'll be looking at is hypertensive crisis. And this topic, after this, we'll also be looking in detail about some drugs as well. So since we have already crossed 40 minutes, so I'll stop here and we will be continuing with hypertensive crisis. So thanks for watching. In case you like the video, you can give a thumbs up, as well as in case you want the provision of notes as well, you can give a thumbs up. And thanks for watching. If you haven't subscribed, you can subscribe as well. So part 2 will be coming soon. Thanks for watching.